Okay,
All right. Joining us is State Representative Emily Dievendorf. Representative, if you could say and spell your first and last name. I know how to do that, but I want it on video, so we've got that in place. You know,
sure.
my old regular.
Sure, it's State Representative Emily Dievendorf. It's Emily Dievendorf.
Okay. And you are non-binary. What are your pronoun preferences?
They there.
They, there. Okay. So first of all, what was your response when you heard the video of your colleagues discussing restricting healthcare for transgender people, period?
My response was both a personal one, in that I felt it was heartbreaking and offensive because these are folks I work with who smile in my face and will act as if they respect me on a surface level, um, but we know will work against my ability and the ability of my community to exist and be safe and healthy. So at an intellectual level, uh, I am infuriated.
Okay. Um, so have you discussed this within the caucus at this point? And if so, are there any plans to act on what's happening?
So within the caucus, my caucus is well aware that I feel it is a priority that we ensure there is access to healthcare and that we continue to prioritize the safety and equal rights of our trans and gender nonconforming communities. We are still figuring out in Michigan how we are going to do that and how to prioritize that. To me, it is not a debate that we have to prioritize that for as soon as possible because those who want to work against us have it at the very top of their agenda.
Within that context, is this similar to, say, the debate for access to abortion? Are we looking at that significant of a concern? And if so, is this something that you have been discussing with your colleagues about possibly seeking a constitutional amendment even to secure access to health care?
As of right now, I have not been in discussion about a constitutional amendment, but this is very much in common with the conversation about bodily autonomy. When we hear from folks who want to control the lives and bodies of LGBTQIA folks in general, but trans and gender nonconforming folks in particular, we know that there is an interest in making sure that people can't make decisions about their own lives, about their own bodies, and about their own health. This is a consistent theme across the board when really we should be most concerned about what is happening in our own lives and not trying to make decisions for other people.
So, i- at the end of the day, are we going to be seeing any action coming from the state legislature, the governor's office, the state health department, anything to reassure, reaffirm for trans people that their health care is protected in Michigan, right?
I will be doing everything in my power to try to move towards trans sanctuary in Michigan and making sure that we continue to do everything we can to provide equitable health care for all of our Michigan residents, including and especially those folks who are systematically and systemically denied healthcare right at this moment in United States history. It is a calculated effort to deny trans and gender nonconforming people healthcare right now across the country. So in Michigan, I would like us to put in a intentional effort to broaden our efforts to protect trans folks while those attacks are being waged. We do, of course, have civil rights protections now for our trans community when it comes to public services, when it comes to non-discrimination. We may have to pursue legal recourse and start to enforce the fact that we have a right to exist while we are pushing to ensure that we have the same health benefits as everybody else.
Okay. Is there anything that I didn't ask you that you think is really important for the average viewer to understand when we talk about this?
When we're talking about trans and gender nonconforming healthcare, we're talking about attacks on healthcare, period, and our ability to just care for ourselves and our mental health, our physical health, and this is really an attack on our youth. Despite the fact that the conversation is around, for the most part, adult healthcare, we know that these younger generations have a really strong understanding of gender and of themselves and have rejected the lack of acceptance that extremists are. I'm going to start that over. um, uh, we know that these attacks on trans folks across the country are an attack on our younger generations and their insistence that we must all be accepted and that our healthcare and our autonomy must all be prioritized. So while when we talk about trans healthcare, we are, for the most part, we're talking about adult healthcare, and we are not making decisions for children. We are flying in the face of a emerging movement from our youth to insist that we recognize their humanity. It is not going to do extremists any good to ignore the humanity and civil rights of their own children. And that is essentially what is happening here. And it is only going to harm the mental health and physical health of generations to come.
So, one of the state representatives in that Twitter space conversation said that trans healthcare was tantamount to self-mutilation and euthanasia. And that's the reason why they should ban it, because you can't consent to those things. Isn't the the, the idea of cosmetic surgery also technically the same thing if it's not like for restoration from severe damages? So just getting a larger breast size or getting your butt cheeks pumped up with fat things. Is that something that you'd like to see your Republican colleagues also try and ban? If they're going to ban healthcare access for trans, is cosmetic on the list, or should they put it on the list?
I would like to see my Republican colleagues stay out of the health decisions of people's lives, period. They are debating this based on false equivalencies, period, and statistics that really come down to anecdotes. The fact is, less than 1% of all transgender nonconforming folks ever have any confused feelings about their own identity and the any changes that they make to their body. That is less than just about every other medical procedure or medications that we take for any other health or physical or health treatment. We are talking about a form of healthcare that is stable, is consistent, and frankly, is life-saving. And we are infusing misinformation in order to deny people access to their own lives. So I would take the false equivalencies out of it, and rather than to ban more, I would say that we need to talk about facts. and allow people the right to live their lives.
Thank you. And I apologize for my inartful question, but it was something that came up here in the newsroom.
Yeah.
Anything else? Otherwise, I'm going to let you go and get this processed and get rolling.
No, I don't think so. I will send you some images of and statistics on what other medical procedures end up, the statistics on other medical procedures and health treatments. But uh, this medical health care for trans and non-binary folks is something that we know is overwhelmingly a positive, happy, healthy direction for our community to move in, and it is only detrimental to deny it to our trans and non-binary community.